Hello, my name is Prejina, final year student from the University of Canberra. Canberra Health Services has always been a top choice for the new graduate program, and I would be honored to be part of such a respectful and progressive organization. Now I'll be responding to the key selection criteria questions by using the real life examples from my work experience as an AIN and also from my clinical placements. Moving on to the first question, it is about the communication and interpersonal skills. To address this question, I would like to use an example from my recent placement, which was in 11A acute care of elderly ward. During this placement, I was looking after a patient who was admitted due to severe hip pain, and strong acid pain medications was used for her pain management. But during my shift, she had already received her regular and PRN pain medications, but she was still complaining of pain. Her family was present at that time, and they started to become verbally distressed due to her ongoing pain and not proper management. During that time, I stayed calm and used respectful communication to explain them about the restrictions and regulations and safety concerns around the acid medications. And I reassured them that the situation would be escalated to the medical team to review as soon as possible. And I also reassured her that I would do everything possible from my side to help her decrease her pain. So after this communication, the family member became more understanding and less distressed. So reflecting on this experience, I learned as an RN how vital it is to communicate clearly with empathy and professionalism, especially in challenging situations like this with the family and the patients. Moving on to the next question, which is about the medication error. Although I haven't witnessed any medication error in the hospital setting, I have experienced one day in the aged care where I currently work, and I have a good understanding of what I should do in this situation. So during the medication error, I acted quickly and followed the workplace policies and protocols. I immediately informed the RN and the team leader, and the patient was monitored closely with no adverse effect and was reviewed by the medical team. I also followed the open disclosure policy by communicating honestly with the patient and family members about the medication error. I also completed an incident report form, which is similar to Riskman in the hospital, and as well as I did the extra medication training to improve my practice. So this experience taught me the importance of honesty and acting quickly, being honest, and always prioritizing the safe medication practices. So moving on to the third question, I would like to use my experience as an EIN and even in hospital placements where I have worked several shifts where we are short staffed and was caring for patients with complex needs. So during my busy shifts, the first thing I do is I always try to remain calm and prioritize my care based on the urgency, like giving medications, doing blood sugars and insulins first rather than focusing myself in personal care. And I do not hesitate to ask for help with my team members and colleagues whenever needed. And I communicate clearly with my team leader for fair patient allocation if needed. And so teamwork and time management has helped me stay focused and avoid missing critical tasks. So as a new graduate, I will continue using these strategies to provide safe, effective care under pressure to my patients. Moving on to the fourth question, I'm aware about the NHQHS standards and work health and safety policies, and I always apply these principles while working to provide safe and high quality care to the patients. So I partner with the patients from admission till discharge by listening to their goals and encouraging feedback and making care plans according to their need. And I always follow policies and procedures wherever I'm performing any kind of procedure like wound care, falls prevention and infection controls and things like that. I always use PP in a correct manner, use safe manual handling techniques, and escalate the concerns promptly to my body nurse, especially when I notice any early signs of deterioration in the patients. So I also complete risk man reports whenever needed and complete all the mandatory trainings about my work health and safety. So following all these principles, I help contribute to a safer environment and prevent potential harm to the patients. These standards have shaped me how I deliver my care, and I'm committed to continuing this practice as a new graduate nurse at Canberra Health Services. Moving on to the fifth question, which is about the Canberra Health Services values. I understand and strongly align with the Canberra Health Services values of being reliable, progressive, respectful, and kind. One example that stands out was during my hospital placement. I cared for an older Greek woman who spoke very less English, and the staffs at the hospital were struggling to give her medications. I was attending her regularly, and I had built a trust and connection with her. So she took a medication when I approached her. So the patient and the family expressed her their appreciation about my care, and as well as I often receive positive feedback from the residents even at my workplace for being patient, kind, and helpful. So these kinds of feedbacks makes me more motivated to practice respectful person-centered care. I strongly believe that a tiny effort from our side as a nurse can create a big difference in patient's life. So I believe this mindset and values I hold makes me a strong fit for the graduate nurse role at Canberra Health Services. Thank you for considering my application for the new graduate program, and I would be honored to begin my nursing journey with Canberra Health Services. Thank you.